Millions of women experience back pain during pregnancy, but most of them don't know how to go about preventing it. So in today's video, I'm going to talk to you about the most common causes of back pain during pregnancy. I'll talk to you about how to prevent it. I'll share some simple tips to help your pregnancy be more comfortable, and I'm going to talk to you about one of the most common complaints that women have during pregnancy. Of course, that is back pain. So what causes pregnancy-related back pain? Well, there are lots of causes, and in this video I want to talk to you about the three most common that we see in our office. The first is weight gain. Now, the healthy additional weight that comes along with being pregnant puts additional stress and strain on spinal joints, the pelvis, and increases the incidence of back pain in women while pregnant. The second change is the change in posture as the baby grows. The center of gravity shifts forwards and puts additional strain on that lower back and pelvis. Now, the compensation of the ever-changing postures of pregnancy, women often find themselves sitting, standing, lying in unusual positions. And these postural changes increase the likelihood of low back pain and discomfort while they're pregnant. The third is the hormonal changes. Now, during pregnancy, your body produces a hormone called relaxin. Now, this hormone, relaxin, relaxes the ligaments in your spine, your pelvis, the back, and it also helps with birth and delivery. It loosens the ligaments throughout the body. So it can cause, in some cases, instability and pain during pregnancy. So they're the most common causes of lower back pain during pregnancy that we see in our practice. Now, despite the fact that back pain during pregnancy is incredibly common, there are some things you can do to minimize it, prevent it, and at least help manage it. So here are my 6 favorite tips that I share with my patients. The first is to make sure you're wearing comfortable and supportive shoes, avoiding those high heel shoes. Although they look fantastic, they're going to exacerbate the postures that we talked about earlier. The second is to try not to stand for long periods of time. If you do have to stand, and it's going to be a big day, make sure that at least every 30 minutes that you're taking the opportunity to sit or lie down. Number 3, the third, is to sleep on your side with a pillow between your knees, or even invest in one of those beautiful body pillows. It will help support your lower back, your pelvis, and it will prevent the twisting of the pelvis as well. It'll be a bit of a life changer for you. Now, the fourth tip is when lifting, be sure that you're lifting with your knees and not your back, avoiding twisting where possible, because this can put more stress and strain and challenge, particularly with things like toddlers. Now, the fifth is to try some pelvic tilts or hamstring stretches throughout the day. This will help keep your back muscles loose, and it will decrease the chance of them tightening or cramping when it comes to the posture changes. Now, the 6th and final one is to make sure that you stay active. Exercise during pregnancy is absolutely safe. Of course, check in with your healthcare provider. Gentle walking, swimming, yoga are all great things to do. I wouldn't start a really high intensive program right off the bat. Now, if you're having back pain during pregnancy, do yourself a favor. Don't suffer in silence. Use these 6 tips. Now, if you need more help, reach out. Honestly, I'd love to help one-to-one. We'll find out what's going on and help get you a more comfortable pregnancy. In the meantime, have an awesome day.